at jack.org. I'm being joined by Hina.
Yeah, my name's Hannah, as Pratik just mentioned, and I had the pleasure of working with him as the knowledge translation intern this past summer, as well as I'm a part of the Jack.org network as a former Jack chapter member at Dalhousie University, and I completed the campus assessment tool as part of Dalhousie University, which we'll touch on later.
So now that you know a little bit about who we are, we'd like to know a little bit about where you're coming from and who you are. So if you'd like to use that chat function to your right there and type in where you're from geographically and where you're working and what your role is, we'd like that context so we can curate a bit of this content for you. With that being said, let's get right into it. So like I said, we're Jack.org. We're a youth mental health charity that's been around for just touching a decade now. And we exist really to empower young people to identify and address barriers to positive mental health in their own community. As we'll get into it a little bit, we have specific programs to do that, but that's the idea across the board. So the way it works is that we're a staff of about 40 people here in Toronto, work with a network of about 2,800 people who are involved in one of three programs in Jack.org. Those young people then go on to engage with young people in their community to identify and dismantle barriers to positive mental health. It looks like increasing knowledge, destigmatizing mental health, and of course working with administrators to change systems that can promote student mental health.
And so the way we do this is through three different main programs. So we have the Jack Talks program first, which is where we train young people to deliver mental health presentations to other young people in their communities. The Jack Chapters program, where we provide groups of young people with funding and support to be able to identify and dismantle barriers to positive mental health in their communities. And finally, the Jack Summits program, which are conferences held all over the country where young people can get together, learn from each other, and collaborate to be able to take back those new skills to their communities to make positive change for mental health. And so altogether, this creates a network of 2,800 young mental health advocates that are deeply knowledgeable about mental health barriers in their communities and thus are well positioned to make recommendations on how to tackle those barriers.
Really good segue. So if you wanted to learn about our programs, you're at the wrong webinar. We did do a webinar on our programs and on youth engagement broadly in March of last year. You can look up that webinar. Email Perlin, not me. But this webinar is about our Youth Voice Report, which is an output of recommendations to decision makers at all levels, and campus communities certainly, but also provincially, federally, et cetera, about how to promote youth mental health. I'll go through the process of how we gathered some of this information, but the idea is we collected a large body of data and we had to distill all of that into 5 key recommendations that we could then transfer over to decision makers in the form of this report. So before we get into what the recommendations are, we want to talk a little bit about why we did the report in the first place. So over the 8 years that we've existed as a charity, we've built a network of 2,800 young people who are representative of Canadian youth. They're in every province and territory. And of course, we've also gotten requests from decision makers in the past about what smart youth mental health policy could look like, how programs could tailor to promote youth mental health. And in the past, we haven't had the answers. So this year, the last year rather, we went through a process of systematically collecting information so then we could advise those decision makers on how to best promote youth mental health in communities across Canada. Specifically, we asked 3 questions. The first is, what creates mental health struggle among young people? So what is it that in young people's environment that's creating mental health stress and struggle? The second is, what prevents young people from reaching out to help when they're struggling? So, let's say they're already stressed out, the stress in their environment has created the struggle. What is it that's preventing them from getting the support they need? And the last piece is, how can campus communities come together to promote, protect, and support youth mental health, which was a really big question. And the way we answered that is through this participatory research project that we'll talk about called the campus assessment tool that 10 chapters took part in. So I'm realizing that I said that they were representative of all Canadian youth. They're not actually. They're geographically representative of all Canadian youth. We have presence in all provinces and territories in Canada, but we're not. Our network is by no means demographically a representation of all of Canada, all young people in Canada. But what they are is a special group of people. We like to call it the 4Es. So they're an expansive network of advocates, like I said, every province and territory in Canada, 2,800 of them. They have lived experience of struggle, illness, and mental health care. So the stat is 80% have some experience with mental health struggle in their lives. About 2/3 have a diagnosed mental illness, and about 1/3 have lived experience with the mental health care system. So it's a group of people who know exactly what the mental health care system is like and what mental health struggle for young people is like. They're also eager to contribute. So our network is made up entirely of volunteers. So they're really passionate about the cause, and they want to get involved, and they want to help move the needle a little bit on mental health outcomes for young people. And of course, they have advocacy expertise. So Hina, for example, has tried everything on her own, and she realizes that there are some limitations to the form of peer-to-peer advocacy she engages in. So, a young person can tell their friend to access support till they're blue in the face, but if that support doesn't exist, they need to engage with a decision maker to talk about wait times, how to reduce wait times, how to improve resources in the community, etc. So there are limitations to peer-to-peer advocacy that we started to realize and our network started to realize. And the next step then is to engage adult allies and decision makers to make sustained systematic change at the systems level. So some of the ways we gathered that information that we talked about, answering those 3 questions: what creates struggle, what prevents young people from getting the help they need, and what can campus communities do, is one of the ways is through our evaluation surveys. So we embedded these questions in the evaluation surveys. This is our chapter registration survey. To the left of the screen, you can see questions around what creates mental health struggle in the first place. So what are the stressors that are creating mental health struggle for young people? And to the right is what are specific barriers to help seeking. Every single person in our network got the survey as they registered for our program, so we could surface some of this data. Hina talked briefly about the Summit program. There are large to small scale events that are organized across Canada. About an hour in every summit is reserved for a collab session. And what a collab session is really one big focus group where participants go through what barriers are to positive mental health in their communities, how they can address some of those barriers together as a community of advocates. And then the last piece you can see here, phase 4, is an appeal to decision makers about how they can how adult allies can help these young advocates to address some of the barriers and build a community that promotes youth mental health. Here's a copy of a completed collab sheet from Jack.org's Northern Summit. So you can see lots of great stuff on there: food security, more investment in mental health education programs, for example. And then the last piece I alluded to earlier was the CAP assessment tool. The CAP assessment tool is a participatory research project. It's made up of 5 parts. Involves various methods of data collection. And really, it's an opportunity for young people to survey and assess the mental health system on their campus and get a sense of what strengths are to the mental health system, what challenges are, what gaps are. And at the end of it, the idea is you get a wholesome picture of your mental health system on campus, and you can have a meaningful discussion with decision makers that isn't just anecdotal. So it's not just Hina and her friends talking about what barriers they experienced, but it's Hina and a community of young people. We get responses upwards of 300 per each of these tools, who are reflecting on their mental health system and have pointed recommendations on how to improve it.
Yeah, so the campus assessment tool, we also like to call it the CAT. 10 schools participated in it last year. I had the pleasure of being one of those schools at Dalhousie University. And I just wanted to talk a little bit about our experience at Dal, specifically completing the campus assessment tool. So first, why did we want to do the CAT at Dal? So we were a chapter that had been active on campus for about 6 years, and we found that we were hitting a wall with our advocacy work. We found that our peers were more knowledgeable than ever about what a mental health struggle looked like, what the signs and symptoms were, and where they could get help. But we were hearing more and more about problems where they were facing long wait times at the counseling center for regular appointments, how the binge drinking culture in Nova Scotia, and more specifically on our campus, was affecting mental health on campus, and how people were being turned away from the emergency room in Nova Scotia and Halifax during mental health crises. And we knew we wanted to change the systems that were causing all these things to happen, but we really didn't know where to start. And so the campus assessment tool really gave us the tools to be able to identify what we were doing well on campus and what were some gaps in terms of the mental health services and what we could do to improve them. Can you just... Yep. So, oh, sorry, 1 second, go back. So how did we do the campus assessment tool at Dal? So first we had a lot of support from head office at jack.org. So we had an onboarding call with Pratik, as well as monthly calls with the knowledge translation and evaluation team here. Like good children of technology, we always started our research online for all of the research-based questions part of the tool. I'm going to go through each section of the tool more in depth in a second, so you'll get a little bit better of a sense of what I'm talking about. And where we couldn't find our answers online, we were able to consult with the director of counseling and student health promotion on our campus, as well as some of the student union representatives for the services that they offered. And we also surveyed our peers on campus. So we surveyed 318 of our peers for the survey-based sections of the campus assessment tool. And we did this mainly through our own social media, personal, as well as our chapter social media. Faculty on campus was really helpful in sharing the surveys with their students and posting it on their online learning platforms. Different student groups on campus were also very helpful in posting it on their social medias, as well as we canvassed in person at our student union building. So the first section of the tool is, we like to call it the campus checklist. And really what this section is looking at is what key mental health services, programs, and policies exist on campus to serve students. And this was a research-based section that asked yes or no questions. So we consulted mainly online resources, and where we couldn't find the answers online, we consulted our connections to staff on campus. So the director of counseling and health promotion as well. And so you can see some sample questions from the tool in the box on your screen there. And I'll give you some of our results at Dal specifically. So we found that at Dal, our school did have an integrated health and wellness center where counseling services and our physical health center were located in the same physical building. And we found that the counseling center used a walk-in model for intake appointments and crisis counseling. Our school did not have a mental health policy, which we defined as a document that lists existing mental health initiatives on campus, as well as describes the institution's commitment to protecting and promoting student mental health on campus. And we found that our school did not have a policy for withdrawal from classes without penalization for mental health reasons, but this was covered under extenuating circumstances and was considered more on a case-by-case basis. So section 2 of the tool looked at whether the results that we found, the services, the mental health services from section 1, if they were accessible to diverse equity-seeking groups on campus. So meaning those of varying socioeconomic status, Indigenous students on campus, LGBTQ2S+ students on campus, international students on campus, just to name a few different groups. And again, for this section, we consulted online resources for the research parts, staff on campus, and as well as the student union for the resources that they offered on campus. And so at Dal, we found that mental health services were covered by our student health plan, 100% up to $1,000 per policy year. We found that there were specialized counselors and nurses on our campus specifically for eating disorders, as well as we had sexual health nurses on campus that ran our mobile STI clinic. And our services were offered in both English and French in the physical health and wellness center, as well as in 60 other languages through the use of interpreters. Now, section 3 of the tool was a survey-based section, and it really got at whether or not students were, how aware they were, satisfied, and comfortable with the mental health services that exist on campus. So what was the quality of services like, and what was students' satisfaction with the services? So as I mentioned earlier, we surveyed 318 students on campus, and we found that, I'm going to read off some results here. We found that 62% of our students were aware of Dalhousie's mental health resources. 44% felt as though services were available if they or a friend should ever need them. And 59% of students felt that there were barriers to accessing mental health services on campus. And we'll get into what some of those barriers were in a little bit. And so section 4 of the tool, again, was a survey-based section, and we at Dalhousie combined the section 3 and section 4 surveys together. So again, 318 responses for both sections. And what this section got at was, what are those barriers to accessing mental health services on campus? And whether or not they were barriers to access or accessibility needs, are the services catered to what students need? So some of the results that we got, again, for section 4, 43% of students on campus said that they would seek out counseling resources if they were struggling with their mental health. And when we asked them what barriers prevented them from seeking services, long wait times, unsurprisingly, for weekly or bi-weekly appointments with a counselor was the most common answer. 48% of students on campus said they felt as though professors and or staff would think differently of them if they knew they sought mental health supports. And we'll touch on this a little bit later when we go through the recommendations for the Youth Voice Report. We'll come back to that question specifically about professor and staff perceptions. And finally, section 5, which is the last section of the campus assessment tool, looked at the general health promoting environment on campus. So what policies and programs, not necessarily directly related to mental health policy or services, promote student mental health on campus. So for example, a policy on student financial aid may not be intuitively related to mental health, but it may be easier to understand how somebody who's struggling to pay rent may struggle with their mental health. So again, for this section, we consulted online resources, our staff on campus, as well as the student union was really important for this section as they provided a lot of the services to students. So at Dalhousie, we found that school staff and faculty tried to promote study breaks. Staff specifically worked really hard to promote taking study breaks during exams. They also brought in service animals and we had a pony at one point to come in and take a bit of a stressor off. But faculty, on the other hand, were very rigid in terms of providing students with study breaks or cutting them some slack when needed. Our school does offer financial assistance to students, as well. The student union offered emergency bursaries to students who needed some cash because of whatever personal reasons they may have. And we found that our school did have a food bank that was run by the student union, as well as they offered a free food program 4 times a week for lunch, which was funded by the student union as well. And so our findings at Dalhousie, just to give you a bit of an overview, we found what was good. So the Student Health and Wellness Center, having a collaborative model, we found to be very effective. And there are a couple of reasons why this model, integrating both the counseling center and the physical health center in the same physical space, were beneficial to students. So first, stigma reduction. There's no way for someone to know whether or not you're going in there to see a counselor or to get a flu shot. That really helped reduce the barrier of even just getting in the door to accessing services. And the second main thing is referrals. It's much easier to refer a patient that's being referred to a specialist in the same office versus somewhere across town where you have to then travel as well. And it's a little bit easier when the specialist is down the hall, literally. And the other thing that we found that our school is doing really well is the student declaration of absence policy that was implemented. So academic stress is closely linked to mental health stress. Pratik will touch on this later during our recommendations of the Youth Voice Report. But I think we can kind of intuitively understand that academic stress contributes a lot. And so what Dalhousie did to try and mitigate this is they implemented this new policy called the Student Declaration of Absence that allowed students to submit this form instead of a sick note signed by a doctor for any midterm or assignment twice per course per semester with no questions asked. And this was beneficial not only to reduce academic stress on students during times of high stress, but also to reduce the burden on the student health center in terms of physician times and for sick notes and things like that. And billing as well. A lot of insurance billing was happening for doctor sick notes. Some challenges and gaps that we found, unsurprisingly, wait times was the #1 challenge that we found. And even though Dalhousie had the average wait, was on par with the average wait time that we calculated through the campus assessment tool of 4 weeks to access regular counseling services. So meaning counseling on a weekly basis, not walk-in. Students highlighted this as the #1 reason why they weren't accessing services, as a barrier to accessing services. And so one potential remedy to this is to provide other options to students, which we'll touch on again later. An example of which is peer support. So we were one of 6 schools that completed the campus assessment tool that offered peer support to students, had a peer support center. However, our funding was very limited and we had very limited hours. I think it was only 4 hours per week, 2 times per week, Tuesdays and Thursdays, I think it was at the time. And so addressing this by increasing funding to be able to provide more hours may be a solution to the challenges of tackling wait times as a barrier. So what can we do about it? We as students, we can share this information with you through this webinar and through the campus assessment tool report, which can be found on the JAC.org website. And engaging with our campus administrators, engaging with you, is really important for us because we found all this information and what are we going to do with it now? We should bring it to you so that you can see it. And it's also really important for you to be willing to collaborate and be receptive to what we're bringing forward.
Mm-hmm. I think just to wrap this campus assessment tool part up, the important part about the tool is that the assessment highlights both the strengths and the challenges. So in most cases, I'd say with every single chapter, every single campus that did the assessment tool last year, what we found is that there were a bunch of strengths and there was room for progress, which is a key sort of messaging piece when having these conversations. So we got a bunch of data, and then over a period of 2 months, we got to sit with it. Hina, I, and Hannah, who was also in the office at the time. You lucky people didn't have to go through all that. You get 5 recommendations, which we'll talk about. But the point is after distilling all this internal data, we wanted to compare it with what other people in the space were saying. And specifically, we wanted to find out what other people were saying in terms of recommendations for both clinical and non-clinical interventions and the effect they have on mental health outcomes. So for us, it was super important that the evidence ties to mental health outcomes for young people and that it proved that this intervention improved youth mental health outcomes. Our very first recommendation was help young people navigate a very complex mental health care system that's complex for adults just as it is for young people. According to our survey data, 72% said they didn't know what types of mental health services were available, and 62% specifically cited difficulty in navigating the system. The way the system works right now is it's a cut and paste from the physical healthcare system, where if you are experiencing a struggle, some form of mental illness, you walk into your physician's office, the physician sees you, hears certain words, sadness, depression, anxiety. I'm not saying this is all physicians, but generally. And the next step is then referring to a specialist. The problem is, in Ontario, for example, specialists have wait times of up to 2 months, and not everyone needs to be in that lineup to see a specialist. The way the process should work is they should orient you to a suite of non-clinical and clinical resources that are available in your community, and then walk you through a process of what works for you. Ultimately, mental health care and mental health support is about options, and it's at the unique intersection of what your personality type is and the kind of mental health struggle you're going through. So if you experienced a loss recently and your approach to dealing with that is talking with other people, a grievance circle may work for you and may help you cope with your mental health struggle. What we found in our research is that a navigator to help orient you to the suite of resources that exist in your community, both clinical and non-clinical, be it a peer support group or a grievance circle or a psychiatrist or a counselor, helps a great deal. This is a feature of the step care model, and we found that in Washington State, it resulted in a 10% decrease in counseling hours and a 6% increase in satisfaction with the resource that they were eventually linked up with because it was specific to them. And it was also, a navigator was also a feature of the model used by the South Shore Health Authority in Nova Scotia, and it reduced wait times to access services for your mental health from 8 months to about 4 weeks because you were getting very specific services and you were linked to resources that worked specifically for you. What we've also found is that peer navigators help even more. So if it's a young person specifically walking you through the process of what resources exist, and it's a young person you can relate to who may have gone through a similar struggle as you, they help even more, and mental health outcomes for young people are even better when it's a peer doing the navigating. One of our campus assessment tool chapters at UNB St. John have actually implemented this navigator. The role is wellness coordinator. It is an adult who is a full-time staff there and helps young people find out what resources exist in the community and the suite of resource options they have available to them. More often than not, all the resources exist. It's just about finding the right one that works for you. Another key recommendation, and a lot of you here will be familiar with this one and are totally on board with it, is engage young people on key decisions. So this works both at the policy level and at the one-on-one level when healthcare providers are interacting with young people, and we'll get into that in a little bit. So what we do know is that 1/5 of those who are struggling get the support they need. Only 1/5 of them do. And 64, based on our campus assessment tool survey results, 64% of people were aware of services on campus. So these are students who knew that services existed, but only a fraction of that, 43%, felt comfortable accessing these services. And when we asked them why they were not comfortable accessing these services, nearly half said that it was because they believed services didn't meet youth needs. And this is an interesting conversation because the way the mental health system services is set up right now is it bifurcates into child and adolescent mental health services, which meets the needs of young people, very young people, generally focused on developmental issues and things like being on the autism spectrum, et cetera, learning disabilities. And then there's adult mental health services, which is highly clinical for folks who are suffering with serious mental illness. There is then a gray area where young people who are transitioning out of this child identity and a little bit out of adolescence and are not quite fall within this adult category are missed. And during that transition, a lot of young people are missed. So there is a framework. There's a WHO framework on adolescent-friendly health services, and it specifically states that one of the requirements for youth-friendly services is engaging young people in discussions of how these services should be delivered. So that's everything from administration to evaluation to how you interact with a healthcare provider, et cetera. And there's actually quite a few actors in both Canada and internationally who do this work, and I've been building a body of evidence to suggest that when you engage young people in conversations of how services are delivered, the mental health outcomes are far better. In Canada, Youth Wellness Hubs Ontario do work here in Ontario. They create youth wellness hubs where young people are consulted from everything from the physical location of the space to how services are administered to follow-up surveys, et cetera. And Access Open Minds is a pan-Canadian knowledge exchange network that's building a research base to prove that this is best practice in connecting youth engagement on these issues to mental health outcomes. So we went through how young people need to be engaged in policy discussions at the systems level of how services should be delivered. They should also be engaged in one-on-one settings by healthcare providers. This is a challenge because when you think about it, young people with mental illness deal with a double stigma. They deal with the stigma that's associated with mental illness and mental health struggle, but they also deal with the negative perceptions that come with being young people. And often decisions are made for them instead of with them. What's important here is that healthcare providers take a minute to introduce young people, like I said earlier, to the options that are available to them and they consult them on what works for them. This results in far better mental health outcomes according to research, and it's important to keep that in mind as well moving forward. So I was lucky enough to go to Australia for the CICMH conference in the fall, and at that time was introduced to Headspace in Australia that's doing a lot of this important work. To give you an idea of scale, here we have Boundary and Out West that does this Youth Wellness Hub work, and then we have Youth Wellness Hub Ontario, obviously. Altogether, that's about 30 and some change for how many youth wellness centers we have. In Australia, there's about 138 Headspace centers, all under the same brand name nationally. A similar population, similar geographical distribution, and they're doing some excellent work in terms of youth-specific mental health care. In Ireland, Jigsaw is doing comparable work. Look them up. They're great organizations.
And so the third recommendation of the Youth Voice Report is that post-secondary institutions should protect, promote, and maintain positive mental health on campuses by doing four main things. First, managing mental health crisis. Second, serving those who are currently struggling. Third, preventing mental health struggle in the first place. And fourth, promoting wellness more broadly across campus. And so to manage crisis, there are a number of recommendations that we think schools should be doing. And first and foremost is to be able or to ensure that emergency health and safety services can respond to crisis on campus. So I think that's pretty self-explanatory. Next, schools should provide students with information on the available emergency services. And this is both on-campus and off-campus services that are available during business hours and after hours and on weekends. As we know, most mental health crises and struggles don't happen between 9 and 5. So providing students with the information that they need to be able to access services when the counseling center may be closed, when campus may be closed, is really important. Next, schools should ensure crisis counselors are on hand to manage and respond to crisis. So this can be by having a walk-in model of services where students can come in and see somebody on the same day, or having designated crisis counselors for those emergency appointments. And finally, schools should draft, employ, and share suicide response and postvention policies. So from the campus assessment tool results, we found that 3 schools had a suicide response plan put in place, but none of them were available to students. So sharing that information with students is very critical as well. Next, schools should support those who are struggling with their mental health. And first and foremost, this is by providing counseling services on campus, which is, I think, something that almost every single school is doing currently. And all 10 schools that completed the campus assessment tool had a counseling center on campus. And so what we found is that the wait times across the counseling centers were very different based off of what kind of service was provided, where they were located, the school population. And we found that 5 out of the 10 schools that completed the campus assessment tool offered same-day crisis counseling. And the average wait time was about 4 to 4.5 weeks to accessing regular counseling services. So this is like weekly, bi-weekly appointments with a counselor on campus. And so comparing the population size or the student body size resulted in different wait times to accessing counseling services. So those schools that had a population of greater than 15,000 students on campus had a wait time that was about a week longer than those schools with a smaller student population. And we also found offering walk-in appointments had an effect on wait times as well. So those schools that offered walk-in appointments, again, had about a week shorter wait time, a week to week and a half shorter wait time than those schools that didn't, meaning that offering walk-in appointments potentially reduces the burden on counselors in the health system, in the counseling system. So as Pratik talked about earlier, serving those who are struggling with their mental health is less about giving them services and more about providing them with a suite of options, so things that they can pick and choose from to be able to suit their unique needs. So one of these is by providing peer support options on campus. So 6 out of the 10 schools that completed the campus assessment tool last year had a peer support center on campus. And peer support has been shown to be equally effective as traditional CBT. But again, it's less about whether or not it stacks up empirically and more about providing something that people can choose to pursue if they feel that it fits fits their needs. So to support students who are struggling with their mental health, schools should provide insurance coverage for accessing off-campus counseling as well as on-campus counseling. So again, getting at that suite of options that they can pick and choose from. So if we look at the graph here, I'm not sure if it's as small on your screen as it is on mine, but the x-axis shows the amount covered per policy year, so the total amount of coverage each year, and the y-axis shows the percent covered per session, so whether or not there's a copay. So if we look at the orange dot way over on the right, that is University of Toronto, Mississauga, and they offer a very large amount of coverage, so up to $2,500 per policy year, but there is a very high copay, meaning that a student has to pay almost half of their session every time they go to see a counselor off campus. So to give you an idea, in Ontario, the recommended rate by the Ontario Psychological Association, I believe, is $225 per session, meaning that every time a UTM student has to go access counseling services off campus, they have to pay $100 out of pocket. And if you compare this to some of the schools that are up by the 100%, Dalhousie is one of them, they may provide less coverage per policy year. So the largest amount is $1,000 per policy year for 100% coverage, but a student doesn't have to pay anything out of pocket every time they go to access services.
And just a final note there to add, it's important when having these discussions about how campuses can partner with the broader community to serve student mental health needs, that this is part of that conversation. If a student can't access counseling on campus or are triaged off campus, it's important that they have the coverage to access that with limited out-of-pocket spending.
Mm-hmm. And so to prevent mental health struggle, the third thing that campuses should be doing, schools should first implement and enact an early alert system. So what we found was that 6 out of the 10 schools had an early alert system put in place, but a lot of students said that this wasn't being used or currently being used by faculty and staff on campus. And so what we think are 3 critical parts to an early alert system is first, there should be a list of key indicators for faculty, staff, and students to be able to consult, to be able to identify the signs and symptoms of a mental health struggle. Second, there should be some sort of follow-up where someone, an emergency contact, faculty, a counselor on campus, is alerted of the student struggle. And third, there should be an intervention where somebody provides support to the student who is struggling with their mental health. Schools should also embed mental health education into academic orientation processes. So this is the knowledge piece where they know what the signs and symptoms of a mental health struggle look like. And ideally, this would also be carried forward past academic orientation, particularly during times of high stress, so midterms and finals, when this information really might be needed again. And schools should equip faculty and staff with basic mental health training. So we found that 8 out of the 10 schools that completed the campus assessment tool had some sort of mental health training available to staff and faculty on campus. And so based off the results from the campus assessment tool, we found that mandating training for faculty and staff had distal effects on student perceptions of how faculty and staff would view a mental health struggle and their help seeking. So at schools where mental health training was mandated, students largely had better perceptions of faculty and staff on campus than at schools that didn't have mandated training. And the fourth part of the third recommendation is promoting mental health and wellness more broadly on campus. So the first way schools can do this is by drafting, implementing, and sharing an institutional mental health policy. Again, this document outlines what the school is currently doing to promote mental health on campus, as well as outlines their future commitment to protecting and promoting student mental health on campus. And we found that 3 out of the 10 schools that completed the campus assessment tool currently had a mental health policy in place. Schools should also provide accessibility services on campus for students who may have different learning needs and may require support to help prevent mental health struggle. They should also offer transition and support services on campus, particularly for international students as well as mature and transfer students, to be able to become accustomed to a new learning environment. Schools should also permit students alternate exam and assignment options, and this is something that Pratik will touch on in our next recommendation more in depth. And finally, schools should employ student declaration of absence procedures. So as I touched on earlier, the student declaration of absence policy was implemented by Dalhousie University last year officially, and provided students with alternate midterm and assignment writing options during times of high stress, and they got to pick and choose what was going to best suit their needs.
So we're going to jump right into the fourth recommendation now, and this is a big one. So it's reimagining teaching and assessment practices to alleviate mental health struggle among young people. So overwhelmingly, most of our survey respondents, 81%, said that their mental health struggle was tied to academic stress and academic pressure. And we've had a response to this in the past, right? So what we've tried is we've tried to embed mental health content into curriculums. So this is, having a mental health education piece during academic orientation, having it introduced to them earlier in grade school. This way they know what mental health is, they're able to identify signs and symptoms of struggle and reach out for help if they want to. The other thing we've tried is building student resilience. So that's giving them the skills to navigate struggle when it happens, deal with academic stress. And those two things are about half of the conversation. One part of the conversation we haven't had at all is reimagining a very archaic system of education that I've been through, Hina's been through, our parents have been through, you've all probably been through. And it's what we found in our research is it's not so much what's being taught, but it's how it's being taught. And there's something about the way my calculus teacher is teaching me and then assessing me that's creating mental health struggle in the first place. So we then went to the literature and looked for pedagogical and teaching assessment practices that promote youth mental health. Not sure if we find any teaching and assessment practices that are tied to youth mental health outcomes, but what we were surprised to find was that there was quite a rich evidence base of teaching and assessment practices that promote youth mental health in the first place. One of those assessment teaching practices was building a constructivist learning environment, and this is a democratic environment where young people have more choice in the way they learn. So in the methods of learning and the methods of assessment. Specifically, young people aren't just receiving information, but are active agents in their learning and can consult various different sources and learn this way, and that's been tied to positive youth mental health outcomes. Something as simple as allowing students to choose the style of assessment has been proven to promote youth mental health outcomes. So Hina might really like to write multiple choice tests, I don't know why, but if in the event that she really does, and I like writing essays, we should be given that choice. It's still the same rigor, we're still being tested on the same content, but we're given that choice, and that has been shown to alleviate academic stress. Pretty simple recommendation. The next piece is just as big. Again, we didn't want to fixate just on the problems. We wanted to talk about what solutions are, because we could have ended the conversation and academic pressure is bad, social media is bad, but that's too much of a broad statement, doesn't provide actions. Here we found was what was important was encouraging better social media practice by both providing guidelines and developing a safe online environment for young people, and we'll talk a little bit about that. So a second stressor, it was second on our list, academic stress by far, and then second was social media. 54%, just over half, cited social media as a major stressor for their mental health. Early research around this was pretty alarmist. So it was, if you use a certain amount, if you spend a certain amount of time on Facebook or on Twitter, Instagram, you're likely to struggle with your mental health. But more recent literature shows that it's not how much time you spend on social media, but it's how you use it. Because importantly, social media, specifically Instagram, has been an opportunity for young people to interact with one another and build communities of support. So it would be too much of a blanket statement to say that social media is bad. what we're suggesting is, because it's this piece of how you use social media, there should be evidence-based guidelines that guide young people through a process of how to navigate social media in a way that promotes their mental health. And when you think about it, there are guidelines for everything else. There are guidelines for alcohol use. There are guidelines now for cannabis use for young people. And so there should be a similar set of guidelines for how to use social media. What's especially important here is that there's no learning you can do from your parents. I've seen my dad, for example, enjoy a glass of wine, and I know it can be a positive thing, but I haven't seen him put down Instagram after using it for half an hour. And so there are no social cues I can get from my parents, and I need to get this information from somewhere. And so these evidence-based guidelines are very important. The second piece of it is creating safe digital environments. So that's making social media a place that's safe for young people. One of the pilots that's been in the news lately is Instagram removing like counts. While the idea may be to promote youth mental health, we don't know for sure, and their evaluation plan isn't super transparent. We don't know what metrics they're evaluating against, for example. So how are they proving that this like count has a positive effect on mental health? What we're suggesting is that it's important for Instagram and other social media companies that are trying to promote youth mental health and promote mental health more broadly, that they share the tips and tricks and the strategies they're developing. Because what's at stake here isn't sort of internet traffic and profits, but it's the potential to reduce a real health harm. And so if removing these vanity metrics, like counts, improves or promotes youth mental health, vanity metrics are on Instagram, but they're also on Twitter and they're also on Facebook. And if the learning is that it promotes youth mental health, that success should be replicated across social media platforms, and harm should be safely avoided. So it's super important that they share it with other social media companies and also with us as informed digital citizens. Here's an article that's been in the news lately around insight into the hidden likes count and what's happening. There's still, the point of the article is that it's driving engagement with posts down, but the idea is that people are more likely to post now because they don't have the pressure of like counts. But again, no transparency around what metrics this is being measured against and whether mental health was even top of mind when having this conversation. If it was, that's great. We'd like to learn more. If it wasn't, that's also important so that this isn't being misinterpreted. So I'm going to end there. I want to thank you all for listening. I want to thank Hina for co-presenting and for doing a great job with the CAMP assessment tool. I also want to bring up these two links. jack.org/YVR there is for the full Youth Voice report. And as Hina said, there's also a CAMP assessment tool report that you can find, which is just aggregate data on the CAMP assessment tool. But please check both those things out. Please share them widely. We'd appreciate the support. This is the first time we're trying this kind of thing, and we're very happy with how it turned out.
And I worked really hard.
So thank you very much.
Thank you so much, Pratik and Hina. That was an amazing presentation. Really good stuff that you guys have done. I think the last couple of points especially were something to really think and reflect upon. And just for everyone who is still on this webinar, so now is your chance to ask our presenters about any burning questions that you might have had and come up during the webinar. Feel free to use the chat function, and we're going to just pick that up right now. So I guess while we're waiting for questions to roll in, just curious, Pratik and Hina, what sort of feedback have you guys gotten on the report so far? And how have you disseminated it? Mm-hmm.
So far, overwhelmingly. Yeah, so far, overwhelmingly positive. I know that, so we had the opportunity to present it at various different conferences. I had the opportunity to take it to Australia. I got to present, Hina and I presented at the CICMH conference, Berlin, that you put together, and at CMH International. So we've been presenting it in that way quite a bit. I've, of course, shared it online. A real metric for success that we're still looking to hit is the uptake of the recommendation. So it's great that we produce this report. It's great that it exists. It's great that everyone's learning from it. We'd love to engage people, specifically people in post-secondary institutions, around how some of these recommendations can be implemented and work towards promoting youth mental health on campus.
And so is there sort of like a method or a platform for how people are going to take up your recommendations and get back to you on, hey, we tried this and it worked, or should they just shoot you an email?
Yeah, shoot me an email. Yeah, so my email is I'll provide it here. You can follow me on Twitter, um, but it's also at the end of that Youth Voice report. And feel free to shoot me an email to talk about how some of these recommendations can relate to your community and how you can implement them in your community. There's also a lot of opportunities for collaboration. For example, so some of these recommendations are things that we throw to decision makers and ask them for sort of getting the ball rolling there. And also young people, of course, in these communities need to be engaged to that end. But some of these recommendations we've already started a little bit of work on. So for example, building a set of evidence-based guidelines to navigate social media that's by young people, for young people in their words is something we're working on. And if you'd like to learn more about how you can collaborate to that end, again, please reach out.
Amazing, guys. So it looks like we have some questions starting to roll in here. How were post-secondary institutions chosen for the CAT?
Yeah, that's a good question. So the way they were surfaced is they were highly engaged chapters who've existed for a little while. So DAO, for example, and like Hina was saying, they've done quite a bit of knowledge awareness, stigma reduction initiatives, and we're ready to graduate to the next stage of doing the campus assessment tool and wanted to engage in systems level change on a more rigorous way. It made my job very easy because most of them were experienced chapters, were real go-getters like Hina, and it meant that it did feel like pulling teeth, coordinating, getting sections in and filling forms out and getting people on the phone. Most of the time it was me holding them back, not responding to emails on time. But so it was very much a self-selection process. People who were super interested and keen and ready for that next step. Just a quick note on the campus assessment tool. We did do it with 10 chapters last year. We're looking to hit about 14 to 15 this year. And the tool will keep progressing as we include more and more chapters. And the hope is that eventually it will be in communities across Canada and we'll be able to paint a truly national picture of how mental health systems operate across Canada. Anything you want to add to that?
Yeah, no, I think that covers it. Yeah, I will just mention that last year when I completed the campus assessment tool, it was still in its pilot year. So that was why we were really critically picking chapters that were experienced and really wanted to do it because it was the pilot. And then we opened it up to a lot more people this year as well.
Yeah, I think the great thing about the assessment tool as well is the fact that it, I think, integrates very well with some of the other tools that are available out there, like the NCHA survey tools, and I think there's a Healthy Mind survey as well. So I think campuses who are going to start taking up that tool are going to be able to paint a very, well, not extremely exhaustive picture, but a better picture of what's going on at their campuses in terms of mental health.
Assessment tool, I think pairs really well with the NCHA survey because while the NCHA is behavioral and health data, so how many people are struggling with anxiety on campus, what are health behaviors that students are having, the campus assessment tool is about how a system can promote that behavior. So how easy is it for someone to access mental health counseling on campus? How can a system respond to some of that struggle and encourage some of those healthy behaviors?
Great point. Next question is, would campuses that do not have a Jack.org chapter be able to use the CAT?
That's a great question, Bonnie. The answer is yes. We are right now in the development of a simplified version of the campus assessment tool that's just a list of questions that young people can go through. It won't be as robust as the original tool, of course. What we encourage is that young people create a chapter on their campus and we'll support them to that end. It's a very simple process. They go through a basic training online. And the advantage of that is that they get their very own program coordinator here on staff who can communicate with them, and then they get to work with me to do the full version of the campus assessment tool. If they don't want to do the full version of the campus assessment tool and for whatever reason don't want to be a Jack chapter, it's great, you should do it. But if you don't want those things, then there's a simplified version of the campus assessment tool that we are getting ready to open source. Timelines are still up in the air, but it is an option for folks who don't want to go through the formal way.
So while we're waiting for any other questions to roll in, I'm curious. So in, this entire long and arduous process of putting the report together, what was some of the most unexpected findings for you guys?
I think I'll start and then you can jump in. For me, it was two things. The first finding was that how much literature and evidence there was around health promoting pedagogy and teaching practice. You take it for granted, I think, that people who are educators, just do this because it's the way they've been doing it for years. But there are some folks who are doing real cutting edge stuff. I had the pleasure when I was in Australia to go to the Geelong Grammar School that's doing really innovative things and reimagining everything to promote mental health on campus. So that's everything from how students line up to get food at the cafeteria to encourage sort of community and make sure that no one's left behind. So really refreshing to see that so many people are committed to the cause and are thinking about creative ways in which they can teach and contribute in their own way to promoting student mental health. That was the first thing. The second thing, honestly, pretty shocking to find how little there was. So we saw how much of that there was. We were also surprised to see how little there was of guidelines for navigating social media. So very little in the way of evidence-based guidelines to navigate social media in a way for young people to promote their mental health, which is truly shocking given that there's like guinea pig generation now of young people who've gone through social media and just learned through trial and error, right? Like, oh, that thing didn't work so well and I stopped doing it. But we haven't sort of, in a rigorous way at least, brought those guidelines together and disseminated them to young people. We wouldn't do the same thing with alcohol, like I said, or with cannabis use. So it's an interesting dearth of information.
Yeah. And for me personally, I think I'll just comment on in terms of what surprised me having completed the campus assessment tool at Dalhousie. And I think that I wouldn't have been as surprised unless I had had the opportunity to work on, kind of disseminating all those results that we got across the country and putting them together into the report that we published. I was surprised at how well we were doing as a school. And I think that it's really easy as a student to kind of get hung up on what everything your school is doing bad, especially when it comes to mental health services. And you think that it's just like, it's not good, it's all bad, like you need to just start over. And having completed the campus assessment tool really gave me the opportunity to see that, there are a lot of things that Dalhousie is doing to really try and make it better. And, not everything is all bad. Mm-hmm. I think it's pretty easy to get caught in that trap.
All right. Thank you so much, guys. It looks like we don't have any questions right now. So just want to take this opportunity to thank you guys so much again for the great work that you do and for sharing that work with us. I hope that this has been useful for everyone. I certainly feel like it's been very useful for me and lots to take away and think about. So for all our folks on the webinar, thank you for attending as well. And when I end the webinar, there's going to be a little survey that pops up, and that's your chance to share your feedback on the webinar, and which is going to help us to structure our sessions better and give you the kind of content that you're looking for. So as mentioned earlier, the slides and the recording of the webinar are going to be available on our site. And with that, thank you, everyone.
Thank you. Bye.